Tearing a ligament is one of the most common serious knee injuries. An ACL tear may leave the knee unstable and vulnerable to other problems. With a torn ligament and weakened muscles, the bones of the knee may shift as they move against each other. This puts more wear and tear on cartilage, which can lead to gradual degeneration and early arthritis. An injured ACL has limited healing potential. The main reason for this poor healing capability is that the ACL is located entirely within the knee joint and surrounded by joint fluid. This fluid prevents a clot from forming between the torn pieces of ligament, halting the natural healing process. As a result, most ACL tears cannot be sutured or stitched back together. To restore knee stability, the ligament must be surgically reconstructed, which means it must be replaced with a tissue graft. An accident serious enough to tear the ACL may also directly damage other knee structures, particularly a meniscus. Like an ACL, a torn meniscus may not heal on its own. Treatment of a torn meniscus may consist of either removal of the damaged tissue or repairing or suturing the pieces back together. Treating the meniscal tear and reconstruction of a torn ACL are often done during the same operation. The medial collateral ligament, or MCL, is often injured at the same time as the ACL. However, unlike a torn ACL, the MCL usually heals well if it is protected during the healing period. In the majority of cases, it does not need surgical repair. The posterior cruciate ligament, or PCL, is usually injured by a direct blow or a bad fall onto the knee. At this time, only the most serious PCL injuries seem to benefit from surgical reconstruction. However, this is an area of ongoing research, and indications for surgical reconstruction may change with the development of new techniques. The lateral collateral ligament, or LCL, is a complex ligament that runs from the thigh bone to the smaller shin bone, or fibula. Like the MCL, most LCL tears do not require surgical repair unless the knee is unstable.